Welcome everyone to my YouTube channel. This is Muddin again, and today I'm going to solve a USMLE Step 1 UWORLD question of the microbiology block. A 70-year-old man is diagnosed with pulmonary nocardia infection. Medical conditions include hypertension and diet control type 2 diabetes mellitus. Therapy is started with trimethoprim sulfamethoxazole for a planned duration of 3 to 6 months. This patient is at greatest risk for which of the following drug-induced adverse effects? The correct answer here is C, which is the hyperkalemia, because hyperkalemia is a common adverse effect of trimethoprim sulfamethoxazole due to the trimethoprim-induced blockade of the sodium channels in the collecting duct, which prevents sodium-potassium exchange and reduces the renal excretion of potassium, similar to the action of amiloride. This effect is often magnified in the elderly population, so those with renal failure or those given other potassium-sparing diuretics, ACE inhibitors, or angiotensin receptor blockers. Now we're going to read the UWORLD explanation. The trimethoprim sulfamethoxazole is a combination of two bacteriostatic antibiotics that act synergistically to inhibit the bacterial tetrahydrofolate formation, resulting in bactericidal activity. It has a broad spectrum of activity against many aerobic gram-positive and gram-negative bacteria and is commonly used for urinary tract infection, pneumocystis jirovecii, pneumonia, and nocardia infections. Common adverse effects of trimethoprim sulfamethoxazole are rash, nausea, vomiting, folate deficiency with prolonged use. In addition, with hyperkalemia, that was the answer for our question, is a common adverse effect that can occur regardless of dose. Similar to the actions of amiloride, a potassium-sparing diuretic, trimethoprim blocks the epithelial sodium channel, as we've said, in the distal tubule and collecting duct. This reduces the transepithelial voltage and impairs the sodium-potassium exchange, leading to a reduced potassium excretion and hyperkalemia. This effect is often magnified in the elderly population, those with renal failure, as we've said, and potassium-sparing diuretics, for example, spironolactone, amiloride, ACE inhibitors, for example, lisinopril, or angiotensin receptor blockers, for example, losartan. This patient with hypertension, diabetes may be receiving an ACE inhibitor, which further increases the risk of developing hyperkalemia. And those are my accounts, and thank you for watching.